Hi, I'm Dr. Jonathan Chung. I'm a chiropractor and functional neurologist, and today we're going to talk about an important factor in the development of chronic pain called central sensitization. Central sensitization is this process where whenever you have an injury, so in this case, let's talk about a whiplash where the neck muscles or the neck ligaments are injured, you have this acute pain response from damaged tissue. But in addition to the damaged tissue, at the level of the spinal cord and the central nervous system, there are going to be changes that happen to the neurons that actually make your body a little bit more sensitive to pain in order to protect you from re-injuring that area. So some of these things that may be protective that are actually quite painful are when someone touches that area of injury, you actually feel a lot more sensitivity. It feels more tender to touch. Or if you move your neck a little bit more, even though you haven't actually re-injured the area, by turning your neck a certain way, it actually hurts quite a bit more to turn in one specific direction. Now, let's say that a certain amount of time has passed and the ligaments and the muscles of the neck should be healed by now, but you are still having some issues with pain. A lot of times, it's because of those changes at the level of the spinal cord where people still have these painful processes, which means that the neck has actually gone through that healing phase and there's no additional damage that is happening at the level of the neck. But the central nervous system didn't go back to its original pre-accident state, and you're still feeling like you had just recently been in a car accident. Your neck is still very tender, and it's very sensitive to very specific movements. One thing that can drive central sensitization is called microglial activation. So microglia are like white blood cells that are inside of your central nervous system, and they produce inflammation. So after an injury, you may have spots where you have increased microglial activation and they're sitting right next to the neurons that transmit painful information up into the spinal cord and create painful processes. So they're getting irritated by an inflammatory process from these microglia. Another mechanism is where the receptive fields of these red nociceptors can start to spread. So instead of this one red neuron going in and hitting a very specific spot in the neck, you might form branches that actually start to hit other areas of the body. So if you irritate one area of the neck, you're actually lighting up this entire region. Another potential factor is you have cross-wiring. So let's say that you have this green neuron over here that senses movement. So whenever you move your neck, this neuron fires and goes up to the spinal cord. But if this neuron starts to form branches that actually interact and fire on top of that nociceptor that's in the spinal cord, whenever you move your neck, then it's also going to fire that pain-sensing neuron as well, and it's inappropriate. Last factor is you might have areas of your brain that are not working that well, because the brain will usually send something called descending inhibition of some of these pain-sensing neurons. And if you lose that, then you lose some of the pain-eliminating chemicals that your brain releases on its own, and it's not doing its job. In these cases, you have to treat the neurons and not the injured body part.